All right. Well, we're at a couple of minutes past, and I know we have a packed agenda this afternoon, so I'll go ahead and kick us off. Thank you all for joining, and welcome to the Upwardly Global public portion of our board meeting. I'm Tammy Ling, I'm the chair of our board, and I'd like to welcome our other board members, leadership councils, ambassadors, donors, friends, staff. Thank you all for joining. We have a great agenda here for you today, but before we dive into that, I want to send a huge thank you to Juanita and Kathy, who are a couple of members of our board, for which this is their last board meeting after 6 years of incredible service and beyond that. We'll have a chance to celebrate them separately as well, but want to say thank you to them and express our deepest gratitude for their service to Upwardly Global over the past 6 years. So for this program today, we're going to start off with a fantastic speaker from the Minnesota Federal Reserve. We'll then go on to a panel discussion with some UpGlow staff, as well as immigrants and refugees that will be telling their stories. And then we'll follow that up with Gina, our fearless CEO, who's going to share big picture, the state of immigrant and refugee professional inclusion. And then Jane from our Leadership Council will be sharing some updates with us as well. So to start with, I'm thrilled to introduce Tyler Besh. He's an economist with the Community Development and Engagement team at the Minneapolis Federal Reserve. The focus is on societal levers and supporting low-income communities. Tyler and his colleagues have written a fantastic report on licensing reform and found, not surprisingly, that Upwardly Global could help bring home some of that lived experience. They host a symposium in October, and thank you so much, Tyler, for agreeing to present today. And apologies, I meant Minneapolis.
Thank you so much, Tammy. Really appreciate it. And thank you so much for having me. Like Tammy said, my name is Tyler Besh. I'm from the Federal Reserve Bank of Minneapolis. And just want to give a quick disclaimer that any views expressed here are my own, not necessarily those of the Federal Reserve Bank of Minneapolis or of the Federal Reserve System. So with that, we can just go to the next slide. And I wanted to just give a bit of background on where I'm coming from at the Minneapolis Fed, because it might not be immediately clear how our work overlaps with Upwardly Global's. But as Tammy mentioned, I'm part of the Community Development and Engagement team at the Minneapolis Fed. And we work to advance the economic well-being of low to moderate income people and communities across the 9th Federal Reserve District. And we use the tools of analysis, communication, and convening to enhance understanding of emerging issues that affect low and moderate income people, as well as groups that tend to intersect with low and moderate income communities. And one important group of issues that we're focused on at the Minneapolis Fed are labor market institutions. And that's kind of a jargony term that we really just mean the rules that govern the labor market. So we want to know whether certain rules are affecting different groups of people differently. And one specific institution that we're focused on at the Minneapolis Fed is occupational licensure. Which many on the call might be familiar with, but for those who aren't, when an occupation is licensed, it means that an individual is legally required to hold that license in order to practice the occupation for pay. And so think your teachers, your doctors, plumbers, electricians, social workers, all of these are examples of occupations that are licensed at the state level. And we can go to the next slide, please. And what, with our group's focus, we're interested in better understanding whether occupational licensing is particularly limiting for specific groups of people. And we initially analyzed this question by race, and we found, workers of color are indeed less likely to be licensed. In particular, we found that Hispanic workers are about 11 percentage points less likely to be licensed than non-Hispanic white workers. And if we go to the next slide, visualized here, you'll see that across each racial group, the share of those workers that are licensed is lower than white non-Hispanic workers, but in particular, labeled here as Latino or Latina, those workers are about half as likely to be licensed as white non-Latino or Latino workers. And so we see this pretty glaring disparity, and kind of the natural next question is why that might be the case. And we can go to the next slide, please. And certainly, there are a myriad of reasons that contribute to these disparities. We can't necessarily say there's a silver bullet, but one important facet of this that we explored was the difficulties that immigrants face re-entering the licensed workforce after immigrating to the United States. Important to note that about 41% of workers of color are foreign-born, and foreign-born workers are 7.7 percentage points less likely to be licensed than their native-born counterparts. So we do see some evidence of a disparity there when compared to similar native-born workers. And an important aspect of that finding is that when you look across the educational attainment spectrum, native-born workers do have a higher rate of licensure compared to foreign-born individuals. But really where we see the largest disparity is when we look at individuals with more than a bachelor's degree. Amongst that group of workers, we see about a 20 percentage point disparity in the rate of licensure between native-born individuals and foreign-born individuals. And so it's a particularly glaring disparity. So, from the quantitative data, our team is able to establish that these disparities exist. We're able to infer that there are obstacles existing contributing to these disparities, but we can't really understand the mechanisms that are contributing to these disparities. And that is where our partnership with Upwardly Global through this project was really, really important, because it allowed us to add a layer of depth to our understanding of what are the specific obstacles that individuals are facing that are preventing them from continuing on in their licensed professions in the United States. And I know we'll hear a little bit more about that later in the meeting with specific examples, but I just wanted to emphasize that our conversations with Tamar, with Rebecca, and with clients of Upwardly Global, we were able to really get a specific picture of what folks are experiencing on the ground and the obstacles that they're facing on the ground that contribute to these larger disparities that we're able to observe in the quantitative data. So I think that this was a really important example of where the quantitative side of things was really complemented and extended by the lived experience and the work that Upwardly Global and its clients are doing. So if we go to the next slide, please. This is just a visualization of that phenomenon I was describing earlier, where we see at each level of educational attainment here that native-born workers do have a higher rate of licensure. But if you look to the far right, where we're looking just at individuals with more than a bachelor's degree, native-born individuals have a much higher rate of licensure when compared to foreign-born individuals. And, again, I think due to Upwardly Global's work with medical professionals, of course, amongst other types of professionals, but in our conversations, we were really able to see those folks with more than a bachelor's degree and understand, what are they specifically experiencing? And that was particularly valuable as well, again, because we're seeing this really glaring disparity at the higher end of the educational attainment spectrum. And then the next slide, please. And so finally, I just want to leave us with a couple of improvement strategies that we finished our report with, and were really informed both by the quantitative analysis and our work with Upwardly Global. Firstly is improving the recognition of foreign training. There are a growing number of examples of states that are beginning to recognize licenses that were granted in countries outside of the United States. And to the extent that that practice can continue, it would really streamline and enable the reintegration of immigrants into their professions here in the United States and provide the services their communities really need. Secondly is supporting and promoting effective, excuse the typo, navigation programs such as Upwardly Global. I think on the research side of things, we're really quick to kind of dial in what is the optimal policy without thinking about the fact that, you know, these are individuals who are not necessarily familiar with the institutions, the rules, the just even cultural elements of navigating the labor market in the United States. And groups like Upwardly Global play a really essential role in helping folks navigate those systems. Finally, investing in the training of foreign-born workers is essential too. You know, it might be that in a certain occupation, training in other countries does not exactly reflect the training in the United States, but we can focus on where the gaps lie and emphasize training in those areas rather than forcing folks to start from scratch, which is too often the case, and especially on the medical side of things, which is where we were able to engage with Upwardly Global. So, you know, I'll leave it at that. And I really just want to thank everyone for their time. Really want to thank Upwardly Global for their continued partnership, and looking forward to answering any questions that folks have a little bit later today. So thanks so much.
Thank you, Tyler, for sharing such important information. I'm Stephanie Allman. I'm Upwardly Global's National Director of Employment Services, and we have a wonderful panel coming up for you, which will bring much of what Tyler has shared to life with firsthand experience. Many fields are highly regulated, especially healthcare. We all know and have seen this, but specifically those that are joining us today will be able to share their stories and experiences. So our panel will look in particular at the choices that immigrant and refugee doctors face when they come to the US, and what we can do to make that transition into the healthcare workforce easier for them. Before I introduce the panelists, I just want to center us a bit on both the challenges and the opportunities that are in front of us. According to the American Immigration Council, there will be an estimated shortage of 139,000 physicians in hospitals around the country by 2033. At the same time, the Migration Policy Institute tells us that we have 165,000 immigrants and refugees in the US who are internationally trained medical professionals and who are un or underemployed. Together with our partners and supporters, we are working towards meeting America's healthcare labor needs, building a more culturally diverse healthcare workforce, and providing skill and experience-aligned employment opportunities to immigrant and refugee professionals. So to further this conversation today, we have Tamar Frolickstein-Appel. She is the leader of our healthcare career community here at Upwardly Global. Tamar has helped over 400 immigrants and refugees find jobs during her time here at Upwardly Global, which is a remarkable number and remarkable impact. Among them, hundreds of doctors. She's a paragon of care, smarts, and the heart and soul of our work. We also have Joan Sosa de la Cruz. He's one of our job seekers and a doctor from the Dominican Republic. And finally, we have Mohammed Khalif here. He is the head of the Washington Academic for International Medical Graduates and paving a new path for alternative licensing opportunities. As you all in the audience have questions for the panelists, please put them in the chat and we'll answer the questions at the end of the conversation. So Tamar, if you can start us off, please tell us a little bit about your experience working with people who are doctors in their home countries and eager to work in medicine here in the US.
Terrific. Thank you, Stephanie. Thank you, Tyler. It's nice to see you again. I had a wonderful experience traveling to Minneapolis to be part of the panel at the Fed meeting, and excited about this work. Sylvia, you want to advance the slide? So I've worked with doctors who are incredibly accomplished. I'm really moved to see a significant number of you on this call today, and would love to share all your stories. But the doctors who come to UpGlow, they have so much experience. They have expertise in government health service, in international development, public health, And then extensive clinical experience, many caring for patients during pandemics, during wars in their countries of origin. And we know that the demand in the US is so strong, and we need to figure out how to join the workforce, how to mobilize this experience and this experience, these skills for our country now, as these folks are here. I'm so excited. You'll all get a chance to hear from Juan and his experience and pathway. And I'm so excited about Mohammed Khalif and the work that he's doing in Washington State. So to give a little context for this, we see really three pathways when we meet with a foreign trained doctor in our program. The first is an alternative career. So we work a lot with folks, I'll go into a little more detail in a moment, who look at research, look at academia, look at public health, look for opportunities in corporate pharmaceutical companies, other ways to utilize their skills and experience without relicensing, which we know is an incredibly expensive, long, and frankly not sure, not guaranteed process. And I love working with the folks. It's so rewarding to meet someone like Juan, who's in the process, who has amazing experience and skills, and just a positive attitude and jumping in to see them advance. We also and go through the process. And I'll talk a little bit more, and then really want to let Juan talk. And then also, we know that alternative licensing is a huge piece of this puzzle, which Mohammed will go in and share experiences at the state level in Washington State, the pathway for a limited license, which we think could be a great answer for some of these folks. So you can put the slide down. I think people now have a sense of the pathways. I'm just going to talk a minute more. So we know in public health and clinical research that those are pathways that doctors can utilize. These fields, as I said, are less regulated, and there's huge demand in the US for folks to work in hospitals, in universities, in corporate settings, doing clinical research, working in healthcare in public health departments in the US. We've seen a lot of our folks use jobs in, especially recently in COVID tracing and epidemiology, to move into those public health jobs. And so we know that that's a really meaningful pathway that can lead to a professional salary and growth. What can be heartbreaking is to see a doctor who gets a credential as a certified nursing assistant or a medical assistant and is stuck in a very low paying, low moving job. Those jobs can be great pathways towards a more professional job, but we don't want to see our doctors getting stuck, our IMGs getting stuck. So we also know that even starting at these lower level jobs, especially in research and public health, there's great opportunities. We worked with a wonderful doctor who had a lot of international development experience, who started in Illinois as a contact tracer and is now the head of contact tracing for the whole state. So we're really glad we can work with people and help them find these sorts of pathways, but also explore the other two options. We want to take one moment to highlight our relationship with New York Presbyterian Hospital, which I know many of you heard about at our galas, and how having a hospital that's willing to look creatively, really get to know our job seekers, bring them on often in more of a midtermship or an internship, has been a really great on-ramp. And many of those folks have gotten now really professional level full-time jobs. So that's that first level, that first option, and that can often be a starting point, or as I said, it can mean professional growth. We also work with many healthcare job seekers who are relicensing, which is a long and arduous path, which includes 3 exams that cost, $5,000 to start. And then take a lot of time, study. Many of our job seekers need to work during this time. And then we know only about 55% of IMGs match for residencies in the US. There are simply not enough residency programs. If all the folks who were qualified and great candidates could get residency spots, I think we would be thrilled, but there just isn't enough spots. There's a huge structural bias against those with foreign degrees, those who've graduated more than 5 or 10 years ago. So it's can be a really challenging road. So those are, and then I'm gonna let Mohammed talk a little more about the work in Washington State and the idea of an alternative license or a limited license. But we're really excited about doing this work nationally. We have a group in Illinois getting great support from our legislature and our regulating bodies. And so very excited to move forward with that work. And now I think, Stephanie, you have some questions for Juan?
Yes, thank you, Tamar. So Juan, I want to pass the microphone to you. And if you could just share some of your experience, what led you into the medical field in the Dominican Republic, and what's been your experience getting into the medical field here now that you're in the US?
Yeah, thank you, Stephanie and Tamar, for this opportunity to speak here. It's an honor, it's a pleasure. So I came from the Dominican Republic in 2019, and before I came here, I did an internship right after I graduated medical school. I graduated in 2014. So in order for you to get licensed in the Dominican, you need 1 year of internship, specifically in a rural community, which I worked with a rural community for a year. And then I was hired by a public health institution to keep working in the same area in quality improvement and things like that. And I did that for my whole time in the Dominican Republic until I came here. During that time, I worked with quality improvement projects at the national level, actually, in the Dominican Republic. I was involved in many other teams. During my time there, that's when the Zika virus epidemic hit. And we had the experience of working with hospitals, primary care centers, in helping the people and helping people cope with the complications of Zika virus. Actually, we had about 30 cases in the region where I was working of Guillain-Barré syndrome, which is a very rare syndrome that was seen in the Dominican Republic. It was incredibly rare to see so many cases, but we were able to respond, and those were the 30 of them were successfully treated, and they were great. It was a great experience, and that's kind of my background in the Dominican Republic. And as I said, I came here in 2019, and that's when the whole process of getting into relicensing came.
And John, can you tell us a little more about where you're looking to go from here?
Yes.
And some of the barriers and challenges that maybe you've faced as you work to navigate the system here.
Yes. So I talked about what happened in the Dominican Republic and everything, but that whole time over there, I wanted to be a specialist, specifically a neurologist. I got married, moved here to the United States, specifically to Illinois. And after that, I found that there were many things that I had to do in order to be relicensed. One of them was take a few exams, the USMLE exams, the OET exam too, but I didn't know how to do it. I didn't know anything. There was no information. So I'm a little bit of a tech savvy. So I went through Reddit, Facebook, Instagram, everywhere, and hearing from people, hey, I did this and it worked. oh, I did this. So trying many things, what worked, what didn't work, many things didn't work, some did. I found information on how to start the process of passing the USMLE exams. So it took me 3 years to figure everything out. And after 3 years, this year was my last exam, the step 3 exam. And I passed all of them with flying colors. So now I'm still in the process of licensing, specifically applying to residency, neurology residency. And it's been a big challenge, especially when you have a family. I have a 4-month-old right now. So having a family, it kind of makes things a little harder. As Tamar said, some of us, most of us, we work in entry-level jobs. Right now, I'm working as a CMA, um, which it pays very little.
What's a
Actually,
CMA for those of us who don't know the acronyms in the medical field?
is certified medical assistant. And even to be certified as that, it took me time for me to figure out, oh, I can actually do that. Actually, it was Tamar and her team who told me that I could do that. And I got licensed as that, and I started working in the medical field. But before that, I was doing rotations to get some a clinical experience in the United States. And every single rotation for us IMGs cost at least $1,800 or $2,000 for a month. So imagine a person that's working as a CMA, an entry level job, most of us getting paid minimum wage and paying for USMLE exams, which is kind of like about $5,000 for the 3 of them, paying for residency applications, which you pay thousands of dollars to, and also paying for many other of these things. So it's a very significant burden for us IMGs to go through all of this process and do it with no information, no clear pathway. You do this, then this, then this, then this. And some of us have to learn English during our journey when we come here. So I was lucky. I was quick learning English. Many people helped me, but these were my challenges, and I think there are ways that these challenges can be eased. It would have been easier if I had people like Tamar telling me, hey, this is how you do it. I'll help you, and I'll help you learn how to do a successful interview, how to craft your resume, what to do, what are you doing now? You know, it would have been helpful 3 years ago. It was helpful now when I found her. But if I would have found Tamar 3 years ago, I think things would have been even easier. I'm still grateful that I did it after 3 years, but I'm excited. I'm actually excited for what's coming on. I've had some interviews for residency, and I'm just waiting for these people to answer and tell me if I'm good for the job for them. I'm really excited for what's
That's
coming.
great. Well, I know it's a huge success to even be getting those interviews. So congratulations to you. And I really appreciate some of what you're saying too. Really, tying into, given the current state of things, how Upwardly Global's coaching works to support those who are navigating the healthcare field, really thinking about short and long-term goals in parallel so that folks can get started in the healthcare field and start to learn the medical terminology, the English terminology that's technical, and start to develop professional networks while supporting the longer term goals for you, Joanne, getting back into your work as a physician. So really appreciate you pointing out all of that and sharing that larger story and tying it into some of the work that we're doing here at Upwardly Global too. And so, what we do at Upwardly Global as far as our coaching goes is all operating within the current state of things. And of course, given the constraints that there are, our coaches such as Tamar are amazing at supporting folks and navigating the industries, especially these highly regulated industries, and finding their career pathways. But Mohammed, I'd love to have you speak a little bit, because as we look to the future, we see that supporting legislation at a state level is also an important part of simplifying the relicensing process. And that's something that we'd love to see furthered as well. So we'd love to hear your perspectives. Why is it that you're looking for alternative pathways, and what did you accomplish in the state of Washington?
Yeah, thank you so much for having me, Stephanie. Really appreciate it. I really resonated with Johan's story, because I did not have that same support. And I was actually working at a pie factory and doing some other odd jobs. So, it's really great the work Upwardly Global does in coaching in getting people to find alternative short-term solutions, right? We all want that long-term solution, but I think short-term solutions is so important, because you can't, without having a career in place, you can't take the tests. Because sometimes I've seen a lot of folks work 10 hours, 12-hour jobs and then go back home and study, which is certainly sometimes impossible to do. So thanks for sharing that story, Johan. Regarding alternative pathways, I think it's one of the most important solutions, especially right now, when it comes to helping international medical graduates and immigrant refugee physicians get back into the system. Because as Tamar said, there's a huge residency shortage, and there's no, and I don't think it's going to get better anytime soon, because this debate has been going on for almost 40 years right now, where where there's a lot of conflicting interests in our society, where more residency spots would not make sense. And this is another topic for another day, and I can get into it for hours and hours. But in Washington, we had much successes. We looked at this, everything, especially residency spots and shortages, and we said, hey, the feds are not bringing any solutions. We've tried all we could, but we're not right now. We're gonna do what we can in our state level, and ever since we started the Washington Academy for International Medical Graduates almost 4 years ago, we passed 3 legislations that got us up to this point today. The first one was Senate Bill 5846, and this kind of created a task force, a work group that brought communities around Washington together, specifically the educational community, the universities, the regulatory community, the Washington Medical Board, and other individuals as well. It also brought hospitals, community health clinics together, and other folks, and we said, hey, how can we sit together to create pathways for international medical graduates? And from those recommendations, we introduced another bill the following year, and we passed that bill called Senate Bill 6551, which was a program that took those recommendations and implemented it. So they created something called, which I'm really happy about, and a lot of people don't know about, which is, it's called an exceptional qualification license, which means if somebody is exceptionally qualified, they would not need to do residency or even the tests. They could just, just do get a license right away. Because we had some folks, for example, we have some immigrants from Venezuela who were teaching at Harvard, like during their time at Venezuela. And, they were well known here. And right now they're working at Starbucks 12 hours. Which didn't make sense. Like somebody 3-4 years ago was a huge, well-known professor, or somebody who had, experience. Their papers are out there, their research is out there, and right now they're working at Starbucks. So because of that, we were able to get that exceptional qualification license in, which is a license that's out there. Which it's not what we're famous for here in Washington, but it's out there. A lot of people don't utilize it a lot, but we now and then we get some people who qualify for that license, and we're able to get them into work pretty quickly. So, in the last bill we passed most recently is House Bill 1129, which was a game changer for us. So this was a limited license that allowed any international medical graduates who passed the test, step 1, 2, and 3, to be able to practice in Washington State with another physician. So it didn't require any residency, didn't require, jumping through multiple hoops. And it was so simple. You pass the licensing test, you get a license. And this sounds very simple, but it doesn't exist in a lot of states in here. It does exist in Europe, in the UK, and a lot of other places. There's a residency system, but there's also a working pathway system where you could work while you get to the residency system. So, and residencies here in the United States are very expensive, and they're very inflated compared to other countries. For example, it costs $500,000 to train a 3-year program for one resident, and the resident gets paid minimum wage, $12 an hour, 80 hours a week. Where that money goes, there's not been a lot of research into where that money goes. A lot of hospitals have a lot of theories on where that money goes and how it's utilized. But one thing for sure is that it is very inflated and it's not efficient. And so therefore, that's one of the reasons that led us to that pathway, because when you look at the price tag and the number of spots that is needed, plus and it's gonna take a lot of debate to get something like that passed in a large scale, where this is just simple, where you're kind of like helping people to work and using the economy, and people are getting jobs in that way. So we passed that last year, and we've been working on this license for almost just 1 year. I'm happy to say that we've gotten 30 people into jobs. And we have, they are serving almost 2,000, each doctor is serving 2,000 patients. So that's 60,000 patients, Medicare and Medicaid, they have a panel of 2,000. So it's been amazing. We've been able to solve the billing piece of it, which is the most crucial, because a lot of employers, want to know if they could get reimbursed and if this is a sustainable program. My goal is to hopefully get this around the country one day. And I'm so happy to have the support of Upward Globally and other partners to help us continue this mission in getting a lot of doctors into this space. And yeah, so I hope that answers the question, Stephanie.
Yes,
Sorry,
thank you so.
Yeah.
No, you were great. Thank you so much for what you shared and for the amazing work that you've done. I hope that we see replications of this, throughout the U.S. So thank you so much for really pioneering in that way. In the audience, I'm running up on time, so I'm aware of that. We do have special friends in the audience, though, from World Education Services, whose Imprint Coalition supports policy work. And today we have Mike Zimmer and Fatima Sanz with us. And I would like to ask Fatima, if you could, Fatima, if you're here, to just give us a quick top line for a moment about your efforts to influence licensing models across the states, building on some of what Mohammed shared his work is as well. And then we might have a minute for questions. Fatima, are you with us?
Oh, maybe she's not with us right now, in which case let's go straight to questions.
Okay, great. So I can open the chat, or Rebecca, if you have, if you would like to feed us questions in case I miss any.
Yeah, there's a question from Sadiq, who is an Upwardly Global alum and a member of our board and a doctor and now a professor. He says, one way which is proven to be effective is peer support, local support, mentorship, and leveraging the expertise from those newcomers who have come a few years before. How can we expand that nationwide in each state and with different subgroups? And I want to add that Sadiq has really piloted an alumni mentorship program at UpGlow supporting healthcare professionals. So thank you, Sadiq, for the question and for your work.
Tamar, you may be best positioned to respond to this.
Yes, happy to. Thanks, Sadiq and Rebecca. I was going to absolutely start by saying how exciting it has been to work directly with Sadiq, who is an amazing leader in this work. And we have started a monthly group for mentoring specifically healthcare providers from Afghanistan who are struggling to figure out next steps in their pathways. It's been a great way to get involved and to really help bring that group mentorship and support together. We bring a lot of our alumni in to share with this group, and it's been really rewarding. The other model of group support that we've created, and I want to highlight my colleague Rachel Pearson in the DMV, who has worked with me and created a beautiful program to help those folks like Juan who are interviewing for residency to do interview practice. It's been really fun to engage some of our alumni, some of our community friends, other folks in our network who have healthcare expertise. So we are always open to gather with our volunteers, with our community, to figure out ways to utilize your expertise and strength to support our job seekers and move our work forward. So really excited about those models, and also, you know, the work we're doing in Illinois around the advocacy was started by leadership from our LC in Illinois, who connected with our local state rep, who's been just a great partner. So I think that the short answer is we need volunteers, we need mentors, we need advocates. You know, any way that you can support this work, obviously sharing information. We've gotten really great at writing up some great stories. Please share the stories of these folks on your social media. And, you know, it's still Giving Tuesday week. So if you want to make a donation, Upload's always happy to have that kind of support as well.
Thank you, Tamar. And for anyone else who does have questions, please do send us an email. You can email us at info@upwardlyglobal.org. But we are at time for our panel. So I just want to thank you, Tamar, Joanne, and Mohammed for joining me today. It's really such an honor to be able to work alongside you and to learn from you as well. So thank you for your time and for being here. And with that, I will give the floor to Gina.
Hi, everybody. So I just want to bring this conversation we've just had around, because it's really important that we are talking about untapped talent in healthcare. As Upwardly Global, we work with individuals across industries, and healthcare is one of our industries. And it's actually one of the harder industries to work in for all the reasons you just heard, but it's actually incredibly important. And the reason it's important is because it helps us create health equity in communities, right? When we had COVID and the pandemic, we realized how important it is to have doctors and nurses and technicians who look like and speak the languages of the communities across the country to make sure people are accessing services. It's also really important because it helps us create shared prosperity across communities in terms of accessing services. And so while we talk a lot at Upwardly Global about the incredible individual lives, Johan, when you were speaking, just listening to the pride you have from how hard you worked and how much you achieved in your home country, and then having to start, as Tyler says, from scratch here, is just a clear indication of how resilient and determined individuals like you are. And how are we then thinking about how do we open up pathways that exist in our ABLE, but how do we also change the rules of the game to what Mohammed is doing to really ensure that we're making a country that is actually better for all of us, and then that benefits all of us at the same time. So I think that's one of the reasons why I'm so excited about this work, and I think it's so incredibly critical. I know Sylvia is going to share the slideshow again, so you're not just seeing my face, but in case she takes a little bit of time, I'm just going to jump right into it. We did want to talk a little bit, you know, we're ending at the end of the year. We want to give a sense of what we're seeing ahead of us in terms of sort of the macro and where Upload is innovating and supporting this population of immigrants and refugees who come to the United States with skills. So, you know, this past year we have, and year and a half, we've seen a large number of Afghans come into our communities. We're seeing a large number of Ukrainians come into our communities. And we're also seeing a large number of Venezuelans come into our communities. We're expecting more from Cuba and Haiti, but these are some of the large population flows that we're seeing from specific countries. And then, of course, we have this new refugee cap under the Biden administration, which we have not yet started to hit because the priority has been Afghanistan and Ukraine for the administration. So we are expecting really more and more refugees as well to be entering into the United States. Next slide, please. So it will be no surprise then that about 28% of those individuals we have served this year have come from Afghanistan. Now, Upwardly Global has always supported about 30% of our population as refugees. We also want to say, though, it's really important to us to ensure that the services we offer are reflective of the diversity of the communities that come into the country. And the fact that we are serving people from 113 countries just demonstrates that this population flow of individuals who have skills, who have degrees, is really from a diverse group of countries. It's not just one specific country. That makes our work a little bit more challenging, but also makes the opportunity even more rich for the United States. We continue to see that stream of Afghan applicants. We're seeing more and more Ukrainians. So as of August, we started to see a big jump in Ukrainians who are applying for our programs. We've also helped place some of our first Ukrainian communities who have evacuated or left, I should say, since the war started, which has not yet been a year. What's really interesting is that 52% of our population really fits into that middle age bracket. So that's just something for us to think about. That also means that many of these people potentially have families. So they're also supporting their families. On average, they come to us with 5 to 7 years of work experience in their fields already. On the bottom, you'll see some numbers around where we place the highest. So IT, engineering, healthcare are some of the biggest industries where we place. Next slide, please. So this is the first year, we're really proud, where we've already hit over 1,000. Before the pandemic, we were helping place 1,000 people a year. We had just hit that mark in 2018, and now we've already exceeded that. So we're pretty excited about that. Our strategy moving forward is we are not looking to expand our reach through our direct service program. We want to ensure that we're doing quality and that we're using our direct service as a way to incubate and experiment on new ideas. So for example, we have a wonderful New York Presbyterian model, which is a work-based learning model for starting at a mid-internship program that helps them lead to placement in New York Presbyterian Hospital. We're looking to expand that. Now that we see that that works, now we're looking to understand how do we scale that, and then how do we expand it to other hospital systems, and then how do we use this as a solution for hospital systems across the country. And because of that, we're trying to build models that are scalable. We're also leaning in a lot more. We've always relied on technology, relying more on technology. Upwardly Global is investing now in AI-enabled capabilities that will allow us to do several things. And again, we're testing that AI-enabled capabilities, for example. How do we look at skills for our community against labor market, and how do we then help them navigate? You heard a lot about career navigation as a challenge. Help them navigate to the right opportunities for which they're eligible, competitive, and for which there are job openings. And so we're starting to experiment with what that would look like in our direct service. So then we can say, okay, this actually gets the results that we're used to or improves on our regular results. And so then we're scaling that out. Our scale really looks in two ways. Under the Afghan response, we had a open portal for Afghans, and now we just launched one for Ukrainians, which we're super excited about, which allows them to have access to a streamlined learning journey around how to build your resume, how to market yourself, how to do a competitive interview in the United States, how to access some reskilling and upskilling tools from our partners like Microsoft and Salesforce. And then they can access that. And that's really sort of a direct to consumer. The other way we've been looking at scale is working in partnership with other organizations. So we've got a great relationship with the state of New York, working with their Office of New Americans and their job centers to help build their capacity to serve this population. And we're doing the same thing now in the state of California with the refugee resettlement partners. So we're starting to see an acknowledgement of our population is there, and that serving people back into professional roles requires different skill sets. And so how are we building capacity of these nonprofits and organizations to be able to do that effectively? So that's going to be sort of our strategy moving forward in 2023 is really investing in that design and really investing in testing out these new technologies in our direct service program to ensure quality of service. Next slide. So as we're looking into 2023, we have the big conversation right now about recession. We are seeing tech layoffs. We're deep diving a little bit deeper into the data. And I think what we're finding is those layoffs are in very specific units that are not profitable for companies like at Amazon, the layoffs that they've had, and they're not technology across the board. That said, gives us an opportunity to look at the labor market data and where the job opportunities are to make sure we're aligning to that. And to be frank, many of our community typically get jobs at small and medium businesses. About 75% of them do. And so we're still tracking that to see if that's going to be an engine, a continued engine for growth and opportunity for our community. The jobs report just came out yesterday, and I think we start seeing a lot of demand for open roles and open jobs, which creates complication around inflation, but is a good sign in terms of people's ability to apply for jobs and get them. I talked about using and leaning into technology to look at how we scale. We're also really trying to build out our expertise in specific issues. Many of you will have heard that we are really focusing our work on women of color and how do we ensure that we're addressing their additional barriers on top of the intersection of being immigrant or refugee women. We've just talked about the immense opportunity we see in healthcare as we move forward and really pushing that work, continuing to dig deeper. And then I'm reimagining refugee inclusion. This is an important moment. We just had, let's say this, we are seeing larger flows of refugees coming from middle income countries, which have a larger number of people who have college degrees or professional backgrounds. And so as we're seeing this trend, both with the Afghans who are evacuated, with Ukrainians, with Venezuelans, with Syrians before, we're really trying to center the conversation, both with our partners in the White House and the Office of Refugee Resettlement, to really think about how do we center economic opportunity? How do we center it early? How do we ensure it's differentiated to meet people where they're at? And how do we shift away from the conversation of economic self-sufficiency being good enough to actually shifting the conversation to economically thriving being the end goal? So these are some of the priorities we're looking at. As you can see, we're busy. We're not slackers at Upwardly Global, and we're just really excited by all of the opportunity we have to really push opportunity for our communities. I don't know if there's another slides, but I suppose this is the time to take questions or pass it on to Leadership Council. Jane?
Thanks so much, Gina. Yeah, my name is Jane. I'm a member of the Chicago Leadership Council, and I am happy to share a little bit of an update of what the Leadership Council has been working on in the last year. A big function of the LCs is to be able to help fill some of these gaps where Upwardly Global would like a little bit of support. It's important strategically, but there's a need for additional resourcing. And so I'm going to focus a little bit in two different areas. One is advocacy, and I'm really aligning with what we've been hearing about in today's meeting regarding, for instance, supporting the streamlining of recognizing internationally granted credentials, especially in the healthcare space. In Illinois, it's really exciting that the connection that we made last year between Upwardly Global and State Senator Theresa Ma has resulted in a new public act that will come into effect in January of 2023. And what it does is it establishes a task force on how do we streamline recognizing healthcare professionals who are internationally licensed. And so we're really excited about the opportunity for an emergency order that's currently in effect, allowing internationally trained doctors to treat COVID patients, for that to become permanent and be more broadened. And we're also working with other leadership councils to be able to advance advocacy work in other areas, so hopefully we can continue to have impact there. The other space that I wanted to emphasize was on alumni engagement. So, Upwardly Global works with over 1,000 job seekers and places over 1,000 job seekers a year, which means that over its entire history, we have thousands and thousands of alumni. And one of the things that we're trying to do is to create more community amongst the alumni of Upwardly Global. And so efforts that our Leadership Council has been doing thus far is organizing follow-on professional development events for alumni, networking and social events for folks who are based in Chicago specifically. And we're looking forward to, in the next year, hopefully trying to create more of a digital hub for alumni so that more of that community can be maintained and fostered in between professional development events. So that's just a small sneak peek as to what the leadership councils do. There are 5 leadership councils across the country who are supporting Upwardly Global, and we're really looking forward to being able to continue supporting as the team moves into this new strategy. Thank you, and I'll pass it back to Tammy.
Great. Thank you, Jane, and thank you, Gina, and all the work the LCs are doing. Really appreciate it. As we kind of close out the end of this public meeting for the first hour, I want to thank everyone for joining. And if you have other questions, I know there are a bunch of emails and websites posted in the chat. Definitely would welcome you to get more involved with Upwardly Global in the community. And we look forward to continuing the conversation with you. And so I'll let folks then go back to the rest of their Friday afternoons and have a wonderful weekend. And a reminder to our board members to join the other link for our private session. Thank you all.
Thanks, everybody.